Hey you guys, I'm Dr. Sharma, and as you've heard in the news, coronavirus has taken a whole new toll on infection rates in our population. With the infection rates soaring from this new lethal strain of coronavirus, the CDC continues to urge strong travel precautions, hygiene, and consciousness around sick individuals. And last month has stated that this is a public health emergency of international concern. Here are some of the updates and review of content of published articles broken down in simple terms. Today's date is February 28th, which is going to be important because every day that passes, the death toll and infection rate rises. The current global death toll is over 2,800 with over 84,000 infections. And you may or may not have seen my last video, but just a little bit of information about this virus. The coronaviruses are a large family of viruses that replicate using RNA that typically infect respiratory-related cells in the body. These respiratory cells line our respiratory tract all the way from our nose to our throat down to our lungs, which can give you an indication of the symptoms, such as sneezing, cough, runny nose, symptoms that sort of sound like your common cold, which is caused by a non-lethal, more docile strain of coronavirus. Other systemic symptoms include fevers and headaches because the body's trying to fight off a huge infection. In severe cases, there can be a lot of difficulty in breathing because again, this virus infects the respiratory cells. In fact, specifically, it infects respiratory cells all the way down to our lungs, down to the specific units called alveoli. Alveoli are super important for oxygen exchange from the air that we breathe into our blood. The older the patient is, the less likely that they're going to be able to bounce back from this type of infection, as made evident with the large death tolls being older individuals. Spread of the virus is caused by people who are within close contact, closer than 6 feet, and respiratory droplets produced when an infected individual coughs or sneezes. Remember that hand washing is extremely important, especially when you're in public places, when you're opening doors, touching any sort of object in the public place that somebody else could have touched. Now I know you may be living in a city that does not necessarily have the coronavirus quite yet, but if you're living in a main city such as New York or Chicago or other places where coronavirus has infected individuals in that city, make sure you're using proper hygiene. And if you're in a public place and feel like you need a respiratory mask, don't be embarrassed, because again, this is a very serious virus that is spreading very quickly and has a very high death toll. Please take a look at the links below and continue to practice important hygiene. More updates coming to you soon.